Welcome to Naptime Nutrition. I'm Yaffi Lvova, registered dietitian nutritionist and owner of Baby Bloom Nutrition and Toddler Test Kitchen. And with me today is the awesome Megan McMillin of Mama and Sweet Pea Nutrition. Thank you so much for joining me, Megan.
Thank you so much for having me. I'm super excited to be here.
Thanks. We were just talking about the alphabet soup after names, so I'm gonna give all the string of letters. Okay, so MS, RDN, LDN, CSP, IBCLC. So the ones that we're really going to use today, you're a registered dietitian and you are an internationally board certified lactation consultant.
Correct. Yes.
Yeah. So, and today we're talking about food elimination during breastfeeding.
Yes, this is a topic that is like near and dear to me for both personal reasons and just something I really am passionate about with helping women with professionally. So.
Yeah, and unfortunately, I can also relate from a personal perspective. And this is a very charged subject. I mean, women, we're taught from a very early age to not trust our bodies, to not trust our appetites, to not trust really any biological signal that we get, and it definitely hits us during breastfeeding. What if I don't have enough milk? What if it's coming out too fast or too slow? What if it doesn't have enough fat in it? What if my milk isn't good for my baby? I even heard things like, you can't be sad because then your breast milk will be too salty, or what have you. And there are a lot of myths about it, and there's a lot of really bad information when it comes to food elimination as well. So I'm really glad to have you here to talk about this and maybe make people a little more comfortable and dispel some of those myths and really get us back on the evidence-based, honest, what really actually works track.
Yeah, exactly. I couldn't agree more with you. I think that I see this time and time again with breastfeeding women who have this sense of, I don't know what my body is doing. I don't know if it's doing what it's supposed to be doing. Like you said, is there something wrong with my milk? Am I making enough? Why is my baby crying? It must be my milk.
Yeah.
And so, yeah, there is definitely that sense of not feeling like breastfeeding is intuitive, which is unfortunate. And then also we throw in this other factor of diet, and it can really be super stressful for a lot of women. And so that's kind of my goal, is to help dispel some of those myths and really empower women to trust their bodies and feel good about what they're doing. And also just to have the education on when something may potentially be a diet related issue and when it's not, when maybe it's just normal. Because I think a lot of times we don't really know either what's normal breastfeeding concerns and like normal baby infant concerns versus, oh, there must be something wrong. So
it's so true.
Yeah.
It's so true. And I did one of my first Naptime Nutrition episodes was with Dr. Jenny Beaver, who's also IBCLC, who started the Arizona Breastfeeding Center, who helped me a lot when I was first breastfeeding. And we were talking about how when you feed a baby with a bottle, there are tick marks. You know exactly how much they've taken. And breasts don't have tick marks. And we are so used to immediate gratification and knowing exactly what's going on. We see the nutrition facts label on our food. Not that I'm advocating this, but a lot of people are measuring their food or measuring their bodies, and we have measurements for everything. And when you're breastfeeding, it's far removed from that. We're looking for wet diapers and dirty diapers. We're looking for the growth curve, and none of that is something that you can see exactly while you're breastfeeding or exactly after. So if that's a concern for you, viewer or listener, go back and check that episode out, because today we're going to be talking about food elimination. And I know for me personally, I did have to eliminate, but Megan, does everyone who is breastfeeding have to eliminate food?
No, definitely not. And it's actually the majority of women don't and never will have to. And the only time you would ever need to eliminate is if there's really true evidence that your baby is intolerant to something that you're eating. And again, it's actually quite rare. So no, in general, you do not have to eliminate any types of foods to breastfeed. You actually are even liberated from what, typically we tell women to restrict during pregnancy. A lot of those just go away. So you actually have more freedom to eat really whatever you'd like. I mean, obviously we always want people to eat as healthy healthfully as possible, but there's no such thing as a perfect breastfeeding diet or things that you have to eat in order to breastfeed or things that you can't eat in order to breastfeed. So elimination diets are actually quite rare, the real need for them.
Right. And while you bring up the idea of healthfully, so we don't have the restrictions that we had during pregnancy. And we also have an increased caloric need. People often think about the increased calorie need that you have during pregnancy, but it's even more dramatic during breastfeeding. I mean, these numbers are just our numbers. They're textbook. They don't relate to you and your baby, but the textbook numbers are 500 calories per day in addition to what you would normally need to maintain your body. And that's per baby. So for those of us who had multiples and breastfed multiples, that's even more dramatic. But so when you mean eating healthfully, I want to hit on this because this is a really common concern, and I'm sure you hear this a lot. A lot of people think that the food that they eat creates the quality of their breast milk. And to some extent, that's true. But to a great extent, it's really not. And if you're hungry and you're driving and that breastfeeding hunger hits and there's fast food, is that going to ruin your milk?
Right. So no, it's not. Yes, the breastfeeding hunger is real. I mean, it is intense. I think a lot of women are really actually almost taken by surprise by how hungry they are during breastfeeding. It's no joke. But you can understand why. You're producing food for a whole nother human. I mean, all falls on you. But yes, I always tell women that no matter what your diet looks like, your breast milk is always perfect for your baby. It does not matter if you eat fast food every day or if you eat organic salads for every meal every day. It doesn't matter. Your body knows what to do. For the most part, breast milk is breast milk. It's pretty stable. It's pretty consistent from woman to woman. We do see some nuances here and there. There has been some studies that have shown like some differences in, let's say, the breast milk of women who live in a pretty desert-like area versus women who live like near the coast and consume a lot of seafood. You're going to see some differences, like with DHA, especially because of the seafood consumption. So again, there are some things that diet does affect, but overall, your breast milk is pretty consistent and pretty constant, and your diet doesn't really affect it that much. Like I said, there are a few nutrients that are important and can be affected, but overall, day to day, it doesn't really make that much difference to the quality of your milk.
Right. And so the one time that you are going to find a big difference is more in extreme cases where we have like dieting for weight loss during breastfeeding. That can affect at some point, that can affect your milk. I've heard of people going on cleanses during breastfeeding. And if you significantly undercut your calories, that would have an effect. But indulging in fast food or half a pizza, not speaking from experience there, but it's not going to hurt your milk. It's not going to hurt your baby.
Correct. Yes. And the point you brought up about, if you're sad, then your milk might be different and things like that. But there's some cultural differences. I've heard that too, where if you breastfeed while you're angry or while you're upset, then your baby's going to become angry and upset. And so you shouldn't. Those are some cultural differences that we obviously want to respect, but we also want to also provide education on and science-based facts as well. So no, your emotions don't pass through your breast milk. Yeah.
Right. And last week I went to a fantastic talk by Dr. Edith Enger, who is a Holocaust survivor and a therapist practicing in San Diego. And she said, if you don't feel it, you can't heal it. And so if we tell women who are breastfeeding, you're not allowed to be sad, you're not allowed to be angry, it's going to affect your milk, that's going to have completely different repercussions on how they deal with the feelings of becoming a mother and caring for an infant who's now on the other side, who's outside of the body. So you have full permission to feel the feelings that you're feeling, and it's not going to adversely affect your milk.
Correct. Yes.
Yeah.
Yeah.
So to get back on track with the food elimination, I think that was a really valuable tangent, though.
It is, yeah.
Yeah. So what do you look for when you said that unless there's an actual indication of an intolerance or an allergy? So what would an indication be?
So the most common one that we usually see is blood in the stool. Like that's the most common, most obvious, most significant indicator for usually it's for a milk protein allergy or milk protein intolerance. Eczema can also be, if a baby has pretty significant or severe eczema, that can be another clue. They say that colic might be diet related. There's some evidence that shows that's true. There's not a lot. Hives, obviously, any type of hive or body rash. For babies who have like really extreme digestive issues, like if they're having extreme reflux or extreme spit up, or if their stools are consistently like mucousy, or if they're experiencing constipation, which is very unusual in a breastfed baby.
Oh, we lost Megan. Okay. Hang on, I'm just gonna message her, tell her to come back in. Oh, she's coming back. Okay. Okay, you're back.
Oh, I'm back.
I don't know what happened. Okay. Anyway,
I don't know either.
You're talking about colic and extreme reflux.
Yes.
And constipation.
So extreme digestive issues. So again, there's a wide range of what's considered normal for babies, and then we have what we consider to be extreme or excessive. And so it can be a fine line to decide when this is, exceeding what we would consider normal behavior in terms of how much spit up or how, what the stools actually look like. So it really is something that needs to be looked at like on a case-by-case basis, and get like a real big picture. Excessive fussiness, which again is hard to, how do you define something that's excessive? So it can be a challenge to really decide when an elimination diet is warranted. In general, I usually tell moms to trust their instincts, which is something I always go back to. Like, nobody knows your baby like you do. Not me, not the pediatrician, not even dad. Sorry. It just doesn't.
Certainly not the textbooks.
Right. Exactly. Not the textbooks, not the baby books. You know your baby best. And I really do try to tell moms to trust their instincts. But at the same time, I also like to give them, again, the education and the confidence to know when something is just pretty normal, typical breastfed baby behavior.
Right. And so on that note, you were talking about excessive spit up. And I think that that's something that is really often misunderstood, because spit up, when normal babies spit up, that's totally normal. But it can look like a very big volume. But if you were to scrape it all up and measure it, which you're welcome to do if you want to, you'll notice it really doesn't compare with the actual amount being taken in. So you are free to talk to your doctor about it. You're definitely welcome to contact an IBCLC, which is, in my opinion, if with a situation like that, I would first contact an IBCLC, because we live in a world of specialties.
Right.
And that is your specialty. You train specifically for that. So if you have a concern, certainly contact an IBCLC in your area. But a normal amount of spit up really does look like a lot.
It does. And it can be concerning. And then you feel like, then I know a lot of moms are like, well, I just fed them, so then they didn't get any milk because they just spit it all up. And so should I feed them again? Because if I feed them again, I'm just going to spit that all up. Like, is it upsetting their stomach? So there's a lot of worry and concern around spit up. But what I usually tell moms is that spit up is a laundry issue. It's not a feeding issue. It's not a breast milk issue. It's not a baby issue. It's a laundry issue. You're just cleaning up a lot of spit up. You're changing clothes a lot, your own clothes and baby's clothes a lot. And so it's just an inconvenience. It can be frustrating, but it's most likely, in most cases, it's not an issue.
Right. If it does come with a lot of crying, if it comes with a distended belly or maybe a belly button hernia, that might be something to look into a little bit more. And that one I'm speaking from my personal experience with, of course, one of my twins had food intolerances and the other one didn't. So I did not get to benefit from the child who was tolerant. And so there was a lot of spit up. It would have been in the range of what was normal, but it was accompanied by other things. Some of the other symptoms that you mentioned could also indicate other intolerances. So for instance, eczema, you brought up eczema, that could be related to food. A lot of times that could be related to a milk protein or to eggs. It could also be related to soap, laundry detergent, anything else your baby physically comes into contact with. So jumping to say that it's food and going on one of these very intense elimination diets is not the best idea, because you risk undercutting your own nutrition needs, which at that level, some of these elimination diets really do undercut your own needs. And really, eczema, it's while you're trying to figure out what the trigger is, it's okay. It's okay.
Right. And that's the thing with blood in the stool as well. I mean, it's usually something you can continue to breastfeed through. It's not usually something that's really that big of a medical concern. There's usually not any type of risk for anemia, or your baby isn't in a dire situation when you have some blood in the stool. Obviously, it's disconcerting for a parent to see that, but usually it's something that you can, even if you eliminating dairy, you can breastfeed through. You don't need to stop breastfeeding.
Right.
But yes, there's lots of other causes. There's a lot of babies who do have sensitive skin, and it can be detergent and soaps and things like that. Yes, absolutely.
Yeah, and I also like to come back to the conversation on supplementation. And I say that, and I realize it sounds like I'm talking about formula, and we can talk about that as well. But supplementation as far as probiotics, I once it didn't go over well when I was talking to a crowd and suggested supplementing baby with probiotics. And the truth is that the babies shouldn't need supplementation, but there are a lot of shoulds that go along with motherhood. And yes, there are some probiotics in the breast milk, and it's absolutely fascinating how they get in the breast milk, how it comes from the mother's small intestines and gets into the breast milk for the baby's benefit. It's wonderful to study.
It's wild.
It's wild. So let's talk about the shoulds. A baby coming out of the birth canal to a healthy mother is going to be exposed to those probiotics, and if there are no gastrointestinal issues for either baby or mom, and nobody has a cold, we have a unicorn situation where probiotics are not indicated. But generally speaking, something along those lines is going on. There's a C-section, or there's a cold, or something happens, and so it doesn't hurt to get a probiotic in those cases, and that may help, and that doesn't require any changes on the mother's part as far as her diet.
Yes. Yeah. So there's definitely certain circumstances where I do suggest supplementing both mom and baby with probiotics, and the few that you mentioned, like C-section, usually is a good reason to. If the baby got any formula in the beginning, for whatever reason, if they were supplemented with formula like right after birth, and didn't get breast milk as a first food, and if there's other things going on like eczema or other issues, I definitely would recommend it. I usually recommend it when there's antibiotics given during birth as well.
Right.
If mom has group B strep, or if there's something else going on, another infection where mom requires antibiotics, or if baby needed antibiotics right after birth, that's usually another good reason to do a probiotic supplement.
Yeah. And of course, I'm not sponsored, although if they want to contact me, I'd love to work with them. My favorite probiotic in this case is Claire Labs for infants. And I'm also very glad they changed the name from infant formula, because that was super confusing.
Yeah. So the one caveat, though, is that technically they're dosed for 6 months and older. So there's this gray area of age where there's still some concern about giving probiotics to babies this age. But I think there's a pretty strong case for times when it's necessary.
Right. And there's a real lack of evidence for these things, mainly because it's unethical to test it.
Right.
And that's where that's a wall that we hit very often with nutrition, that we can't revise certain recommendations that should be looked at again because there isn't an ethical way to do the testing. And so that is this as well.
Correct. Yeah. And that happens with breastfeeding and breastfeeding research as well. I mean, it's very difficult to actually do breastfeeding research because of ethics. We don't want to deny one baby breast milk for the sake of a study.
Right. So we have to look back on situations that have been unfortunate that have happened and look for research retroactively.
Right.
Yeah. Yeah.
Which is challenging.
It is challenging. It is challenging. Yeah. So what should someone try first if they believe that if there's blood in the stool, if there's something going on with the baby and they feel in their gut or they've been told by their lactation consultant or pediatrician that an elimination diet may be appropriate, should they just eliminate everything and introduce things slowly, or should they start with a particular food or set of foods?
So in the majority of cases, dairy and soy are the biggest culprits. That's what we see. Those are the most common intolerances, the most common allergies in infants. And so usually that's the first thing that would be recommended. So, and we see it's usually dairy. And then we see a lot of babies who have dairy intolerance or dairy allergy that also react to soy as well. And so usually it's kind of a combo. So most of the time, dairy and soy are the first to be eliminated.
Yeah, I know in my case, it was dairy and gluten.
Okay.
And that was for a full year, which is also very abnormal because when you're doing these eliminations, it's because the infant's gut is not mature enough to handle these proteins. So because of that, they will grow out of it. And so if you're experiencing this and if you're really sad, you can't have milk in your coffee, it's not something that is supposed to be permanent.
Correct. Yes. In most cases, it's temporary. The general guidelines for, especially if it's like allergic colitis, like blood in the stool, usually what we recommend is for 6 months or until the baby is a year old. That's whichever comes first is usually what the general guidelines are. If it's for other reasons, like maybe excessive spit up or excessive fussiness, usually in my experience, I've seen moms be able to do it for a lot less time, like maybe 2 or 3 months even, and then slowly start adding things back in and the baby seems fine. Because yes, usually it's because there was some sort of hit to the gut at birth. And so there's some inflammation and some healing that needs to happen, or just because of immaturity and they're just not ready to handle those proteins.
Right. And so when you do reintroduce it, what I've advised in the past, and of course you're the expert, is that you don't have to just go all in and say, okay, well, this is the timeline. I'm going to have a big milkshake now. If you have a tablespoon of yogurt, that should be enough to safely give you an indication if the baby's ready to handle that or not.
Right. Yeah. And I do think it's better to kind of slowly ease your way back in versus just diving into a pizza. I do. And again, it depends. It's a very individualized plan because we don't have a whole lot of research on this. And so usually what I recommend is similar to what they recommend for people who have like a true IgE allergy, which is there's like a ladder, they call it like a milk protein ladder. And so, starting with things that have dairy like baked in it. So like a muffin that has dairy baked in it. And then moving up from there to maybe like processed cheese. So a pizza, for example, and then moving to like unbaked cheese and then to yogurt and then to actually drinking milk. That's usually what I recommend. Again, it does vary on what's going on with that baby, how severe their symptoms were, things like that. But it should be kind of a slow, gradual reintroduction. But it doesn't have to take forever either because you would probably know pretty quickly.
Right. And for anyone who's geeky like me and wants to know why that ladder makes sense, it's because the more processing something goes through, the more the protein structure is changing, and the baby is reacting to that protein structure. So when you bake it, it's altered significantly, and when you ferment it, it's altered but not as much. And then if something, and as you get closer to milk to drink, the protein starts taking on its natural structure. And so that's why we have that ladder, and that's why that's effective.
Yep, exactly.
I just like to appeal to the geeks like me.
No, I appreciate it.
Yeah. So, and on the subject of milk, considering it is the number one culprit for these things, even though, as you said, this whole situation is very rare.
Yep.
With a lot of different foods that are triggers, it's more of an immediate reaction. But with milk, sometimes you have to eliminate it for a certain length of time before you see a change. So if you suspect a child is intolerant to dairy and you cut it out for one day and you don't see a change, that's not really your whole answer, right?
Correct. Yes. So I have worked with families who've seen a dramatic difference after a day or two. That's not the norm. It usually does take, I would say, a bare minimum of a week, but usually it's 2 to even 4 weeks before you might notice any change in the symptoms. And so it can be challenging because, mom's like, oh my gosh, I haven't had, cheese in 3 weeks and my baby is still like super fussy. His skin is still broken out and I don't think this is working. What am I doing this for? And they feel very frustrated. But so I always do say it could potentially be 4 weeks before you really might see a difference. And so you have to be in it to win it. You have to be committed to seeing it out for 4 weeks. And to be honest with you, some moms just aren't, and that's okay. Yeah. I've worked with plenty of moms who are just like, I don't think I can do it. And that's fine. You don't have to.
Yeah. Yeah. So, okay. On that note, if this is too difficult, if someone just doesn't want to do this, and maybe the baby's symptoms are fairly mild and you can breastfeed through it, at what point do you say this is not working for the baby and choose to go a different route? Because this is a very emotional thing for women to see that the baby's having a symptom, however mild it might be, and then relate it to their milk. And, they might say, well, it just might be better for me to ditch this whole thing and go for formula. And that's also a valid, also valid. We have to take care of ourselves. This is not the only way to connect with baby. So, okay, I'm going to stop ranting.
No, I appreciate your rant. No, I absolutely, and I never make that call. I don't ever make that call because, again, I think it's the mom's decision. I think it depends on the mom and baby dyad. I think it's on what mom's breastfeeding goals are. Maybe the baby's 5.5 months and her goal was 6 months. Then maybe to her, it doesn't seem worth it to eliminate dairy and soy and eggs and gluten. Maybe we're at that point where she's already done dairy and eggs. And now we're saying, okay, maybe it's gluten. And, she might just be like, it's not worth it anymore. Like, I don't want to see my baby like this. I was planning to stop breastfeeding in a couple weeks anyways. Like, let's just make the switch to formula. And I completely support that. It's always mom's decision. And I think, a happy mom is a happy baby. So, but in those cases, you do need to make sure you have the right formula. If your baby is still having true intolerances and allergies, because your typical baby formula is a whey protein based formula. So it's milk.
Right. And there are other formulas you can go with. And I did an entire segment on how to choose a formula. So that's, if that is a struggle that you, viewer or listener, is going through, you can go and check back on that segment, because that can be a whole struggle in and of itself, much like trying to find the right birth control or trying to find the right yoga instructor, it's like, this is one of those things where it's not just, okay, I'm going to use formula now and get something off the shelf. Sometimes that's a bit of a journey as well.
Right. And there's also a little bit of, maybe controversy isn't the right word, but there's also a little bit of misunderstanding and miseducation between some of the formulas, like what you would consider like hypoallergenic versus the, completely hydrolyzed, the amino acid based formulas. And so sometimes parents are told by doctors to start with one and then move on to another more extreme one. And some other doctors will say, no, just skip the hypoallergenic and go right to the amino acid base. So I think that's a good conversation to have with the doctor in terms of like what they think your baby needs. So.
Right. And I think that's a great call because all of these formulas meet certain standards. They all have to meet certain requirements for safety and nutrition in order to be available to the public. So you're not going to make the wrong decision.
Right.
So it's not a possibility that you make the wrong decision because there isn't a wrong decision in this case. So it's good to have an open dialogue with your doctor. And if you don't feel that you can have an open dialogue with your pediatrician about this, you may consider getting a different pediatrician. You should always feel like you can express your concerns to your doctor. Yeah,
about any issue.
Yeah.
Breastfeeding too. I think that's a big reason. I think a lot of women end up switching pediatricians when they realize that maybe they're not on the same page in terms of breastfeeding and their goals and the type of support they need. So.
Right. I changed pediatricians when I was told one of my kids wasn't sleeping well, and the doctor told me, well, you have to let them cry it out. Let them cry for 5 hours. And I was like, no, even people who do cry it out, that's excessive. Yeah. And honestly, in the end, it turned out he actually needed surgery because his airway was 90% occluded by adenoid tissue. And so good call changing doctors. But you should always, if you feel like you're not being heard, you should change doctors.
Always.
Yeah. So back to this whole elimination thing, there are certain food elimination plans that you can find online. And I find that I'm sure you've had the same experience that we get women who are eating, I forgot what it was. It's turkey and something else and like nothing else. And they're desperate.
White rice and lamb.
Yes.
Yeah. That's about it.
So is there a place for that plan?
I have yet to see it personally, to be honest with you. I think I do see a lot of women that start out super extreme where they've eliminated like 10 things to start, or, even 5 or more things to start, which I don't think is the right way to go. I think you need to start small and see how things progress, in terms of let's wait 2 weeks when you're just off of dairy. And then if things still aren't good, then maybe we could, cut out eggs, or we'll cut out wheat at this point. But I think it's much easier that way. I think it gives women a lot more options in terms of what they can eat. And nutritionally speaking, you're not as severely restricted as you are when you do those total elimination diets where you're left with just white rice and lamb, or white rice and turkey. It doesn't really tell you much either, because when you jump to that, as opposed to maybe working your way up to it if necessary, you don't know what your baby is reacting to. So it leaves you still without any answers. And it's really hard, really, really hard.
It is. Really, and then at some point you're going to be doing food introduction and you don't know what's safe. So never mind, your diet is extremely restricted and you don't know what the baby's not tolerating. But when you go to introduce food around 6 months, you don't know what's safe to introduce to the baby.
Correct. Yeah. It's just way too restricted. And like I said, I think it's always better to start small and then add things in, or cut things out, I should say, as needed. But jumping to like, a 5 or more, or even 3 or more elimination diet to start is pretty severe and restricted. And I don't think it's necessary.
Yeah. Well, I'm 100% with you on that.
Good.
Yeah. So do you have anything else you think that we didn't touch on that? Oh, I got one.
Okay.
Yes, I'll answer my own question. So if a woman has been pumping and identifies a food allergy and has all this pumped milk stored, what do we do with the stored pumped milk?
Great question. It depends, but it depends on a couple things. It depends on how old it is, because frozen milk does expire at some point. So it depends on how old it is. If it's getting close to being expired, you can do a couple of things with it. Donate it is one of them, which is a great use for it. I always tell women, if it's not close to being expired, I would hold on to it, because it can be used it could possibly be used in the future. Because like we talked about, a lot of times babies do grow out of these intolerances. So you could feed it in the future when you feel like baby has potentially outgrown this period of intolerance. You can, in some cases, use it for things like milk baths. It depends on maybe what the symptom is the baby's having. Like if you think they might react to that protein on their skin, then maybe it's not the best idea. But I have a really hard time telling women to throw out milk that they've pumped. They've pumped and they've worked so hard to get and save. Usually, hopefully, again, this is something that they could probably potentially start to slowly introduce to the baby in the future once we feel like maybe they've grown out of the intolerance.
Right.
What were your thoughts on that? Did you go through that personally?
No, I didn't. Honestly, I was trying to pump with my twins, and I still don't know why I was trying to do that. I was home with them. I didn't have plans to go anywhere. One time we were going to a wedding. It took me a week to pump 2 bottles so that we could go to this wedding, and then they wouldn't even take it. Mm-hmm. So that's not a personal experience of mine, but I have had women ask me about that. And that was in more extreme cases where the baby was having fairly violent reactions. Mm-hmm. And she did end up donating that and felt pretty good about it. She was too scared to give it to the child. And that's another thing. We need to look not only at the physical, but at the relationship, the emotional relationship, because a lot of women are breastfeeding in order to get that connection, which we've also said, should the breastfeeding relationship not work, you can get that connection other places. Yeah. But if you're looking for that connection, but that connection comes along with a lot of fear and anxiety and a heartbreak, that is not the relationship you're trying to have with your child. So it is definitely time to seek help from a professional with that and evaluate the relationship and see how to move forward in the healthiest way, physically and mentally.
Right. Yeah. It's a tough situation. And I really, that's the one thing I really stress with moms is like, don't do this on your own. Don't make the decision to do it on your own. I definitely recommend seeking out, the advice from an IBCLC, the advice from your pediatrician, put it all together and go from there. But I feel like a lot of women just do this on their own. And not that that's bad, but there's a lot of times you don't need to do it. So I just feel like it's probably being done more than it needs to be done. And I think it's also sometimes being recommended more than it needs to be recommended from healthcare professionals. But I just feel like it does come with a lot of challenges and it can produce a lot of anxiety and fear. And so it can potentially change that breastfeeding relationship. And if it's not truly necessary, then why are we putting moms through this? I've seen that happen before where it actually there was a misdiagnosis and a mom was on a very severe elimination diet, and turned out her baby actually had a pretty significant medical condition that was causing the blood in the stool, and it wasn't related to an allergy at all. And that baby never relatched. And it was kind of a mess. And I just feel like we really do need to take the big picture into consideration and understand how, potential intolerances and allergies and changing mom's diet and will ultimately affect the breastfeeding relationship. And my goal is always to protect mom's goals. And so if, mom's goal was to exclusively breastfeed to 6 months or exclusively breastfeed to a year or just breastfeed as long as possible or whatever it is, whatever her plan was, my goal is to support that plan. And I just feel like sometimes moms are given misinformation or they're not given any information at all. And they're doing what they think ultimately is best for them and the baby without really realizing what that could look like in the future.
Right. I think that's very sense. Yeah, it definitely does. And we just really are, as dietitians, I believe we are starting to look at a bigger picture, not just the textbook and the numbers that define physical health. We need to look at the bigger picture. And this is part of that. So thank you so much, Megan, for coming on. This was a pleasure.
You're very welcome. Thank you.
Yeah, and
it's a topic I love to talk about, and I know you do too.
Tell our audience where they can find you.
Sure. So I am, I'm pretty active on Instagram. I'm at the Lactation Dietitian on Instagram. And then my page on Facebook is Mama and Sweet Pea Nutrition. So they can find me both those places. They can find me on my website, which is also Mama and Sweet Pea Nutrition.
And I've loved your blog posts, so people should definitely check that out as well.
Thank you.
Thanks. Well, for anyone in the Phoenix area, come join me at Toddler Test Kitchen. Dates and registration are at toddlertestkitchen.net. And Nap Time Nutrition is always, well, as best as I can make it on Tuesday at 1:15 Arizona time, 3:15 East Coast, except the rest of you are changing your clocks and whatever time zones. And now I'm on Apple, Spotify, Stitcher, and iHeartRadio as a podcast. So thank you for tuning in and join me again. Thanks so much, Megan. I will see you in our fabulous Instagram pod.
Bye, Yaffi. Thank you.